I want to thank everyone who is involved in our suicide prevention efforts in San Diego County. For everyone out there who may be struggling, who's going through something difficult, I want you to know that the community cares for you, that there is no judgment for what you're going through. There are services and people that are there to help you through the difficult path that you may be on. And a big part of what we've been trying to do the last few years by investing in mental health care is to tackle and break down these stigmas. Just the same as if you had a broken bone, you would not question seeking out help. If you're having some struggles, some mental health struggles, there should be no shame at all in reaching out to seek help. And our Access and Crisis Line is there. Our mobile crisis response team is there to come to you wherever you are in a non-judgmental way. And to all the families out there who have been impacted by suicides, friends, loved ones, and family members, I want you to know that the loss that you have endured is tragic and heartbreaking, but it is in memory of that we're motivated to continue to work and continue to push. And I would venture to say that every one of us knows someone who has gone through their struggles and their challenges. Life is hard, and as we work through these things, we have to make sure that we're there to provide the help and support that individuals need, to show grace, compassion, empathy, to provide support to individuals who are there, and to continue to see forward progress. The more barriers we break down, the more access to services we provide, the more lives that we can save. And it's not just the life being saved, it is the lives that are helped to live a life of purpose and meaning and be fulfilled. Since 2018, we have been seeing a year-over-year decrease in the number of suicides in San Diego County. 2021, we saw that number drop, 364 lives lost. A pretty significant decrease from where we were in 2018, but again, 18, 19, 20, 21, we are seeing year-over-year decreases in the number of suicides in San Diego County. And we take to heart that we certainly have a ways to go. We would like to get that number to absolutely zero. And so we continue to move forward, but we are encouraged in these efforts that the collective action of all of those in our healthcare settings and all of those in the counseling world and the first responder community, family members, everyone coming together is pointing us in a direction of progress, but we still recognize the tremendous emotional toll that is taken and the loss that we continue to see. And so we motivate, despite the fact that we see progress, that motivates us even more to continue to do more, to continue to be there for more people in more meaningful ways. We know that suicide can be prevented. If you know the signs, if you find the words to talk about it, if people will reach out for help and support. Stan mentioned our mobile crisis response team. This is a great access, 24/7 countywide. They will come to you wherever you are at a time of crisis. The mobile crisis response teams work incredibly well with our crisis stabilization units. We've been increasing countywide as a place you can go to get that help and support that you need and continue your path to recovery and to wellness and moving forward. So as a county, we are very committed to providing a better way to provide behavioral health services, both mental health and substance abuse services, and we know that this is one critical piece of it. So again, anyone out there who's struggling, there are resources that are there for you in a non-judgmental way. We encourage you, just the same as you would if you had a physical injury. Please do not hesitate for reaching out for help. And again, for all of those families and loved ones who have been impacted by this, we know how incredibly hard this can be for the rest of your life and how it impacts you and your family. And knowing the emotional toll that takes continues to motivate us to see more progress. I want to see the numbers go down in 22 and 23 and 24. We don't want to turn backwards from the progress we're making, but we want to accelerate it and continue to see more. And so I'm incredibly grateful to everyone who's here and incredibly grateful for all of our partners. Those that are here with us today really represent the folks on the front lines who do the hard work day in and day out. Putting in place a policy or funding a program in many ways is the easy part. The real hard part is the folks who are represented here today. And so for every social worker and clinician, for every peer support specialist, every person who's out there and as a PERT clinician or riding a mobile crisis response team or staffing the Access and Crisis Line on the phone, for all of those individuals, you have our eternal gratitude and appreciation for the hard work that you do, and it means a tremendous amount. Thank you, Stan.